Hello, good morning. Rise and shine. It's a new day, the sun's out, the weather is beautiful. However, it may be too hot for some of you guys out there. Try to stay hydrated and get as much vitamin D level as you can, because vitamin D is a topic of discussion today. So today I woke up in the morning, I was scrolling through YouTube, and I came across my most trusted provider or researcher online, and his name is Dr. Berg. He was discussing the importance of vitamin D and tick bites. So just to give you a bit of a background on tick bites, if you were to get bitten by a tick, they transfer a disease to you that can affect your general well-being. You can get symptoms similar to flu symptoms if you were to get bitten by a tick. And that includes achy joints, you start to develop a fever, and if the symptoms get worse, it can affect your heart. You start to get some chest pains. You can potentially get arthritis. So all of your joints start to hurt little by little. Overall, you just don't feel like you have a flu. And typically, these persons who get bit by a tick bite, they will go to their provider, and on their skin, they will see a red raised bump and a circular ring around it, which would be significant for Lyme disease. And then the provider will tell you, you've been potentially bitten by a tick and you have Lyme disease, so I'm going to give you a course of antibiotics. There's various antibiotics that will be provided to you, and the duration of the antibiotic depends on how bad the tick bite is in terms of your symptoms. Now, in Dr. Berg's discussion, he states that he does not accept any antibiotics. And the reason being is, in studies that I've seen, and what he's discussing, is the daily recommended vitamin D for patients that go to the doctor's office that are required to keep up on a daily basis is approximately 600 up to 2,000 units of vitamin D daily. 600 units, he claims, is just to manage the bones, and that amount can help the bones stay strong for up to 3 weeks. And the daily recommended value for the National Institute of Health for people who are in their adulthood is approximately 1,500 units to 2,000 units of vitamin D daily. And then younger children and older adults, it can vary. But in comparison to what he recommends in order for us to have a strong and healthy immune system, he recommends 10,000 units of vitamin D. Have you heard that number before? I don't think I've ever heard anyone prescribe 10,000 units of vitamin D. And this is the latest research, that you need at least 10,000 units of vitamin D to increase your immune system, in addition to taking zinc, magnesium, and K2. These three elements help vitamin D regulate your immune system. Now, during the COVID pandemic, a lot of people were getting sick. There were many people admitted into the hospital. They were not recovering well from the infection. And we all wondered why. Why were so many people admitted into the hospital? During that time, there was a lot of independent researchers who were looking into vitamin D. And they found a strong correlation between those who were admitted and those who had low vitamin D. So in order to combat this, they released articles that said, if you don't want to go into the hospital and you don't want to be infected with a respiratory infection, you need to take more vitamin D. Their levels were probably less than 20, which in research, according to the National Institute of Health, is considered vitamin D deficiency. According to my research, the recommended vitamin D levels in order to have a strong, healthy immune system is somewhere between the levels of 30 and 40. Now, why were these people having such low vitamin D levels? Maybe it's because they were not getting enough sun. Maybe because they were dark-skinned and they had a malabsorption of sunlight into their bodies to help make the vitamin D. Maybe they were obese. Obese people have difficulty regulating the production of vitamin D in their systems. It's not like somebody who was in their average weight range. There's a blockage when you're obese. So that's why there's a lot of emphasis on being a healthy weight and not having excess fat in your system. Maybe they didn't consume enough fish, fatty fishes, like mackerel, like salmon, like sardines. Those have high vitamin D content, as well as egg yolks and fortified milk. That's the recommendation, that if you're not eating these foods with high vitamin D content, then you're less likely to make the production of vitamin D. And if we reflect on our diet, or your diet, are you actually consuming foods high in vitamin D? You can go ahead on Google and type in foods with high vitamin D content. How much of that are you actually eating daily? And if you're not eating those foods, and you're not going outside to get enough sun, and you're not supplementing with the right amount of vitamin D, then you're at a high risk for contracting an infection, a respiratory infection, a tick bite infection, according to Dr. Berg. So what he recommended was for us to take 10,000 units of vitamin D daily. We need at least 10,000 units of vitamin D within every 24 hours in order to keep our immune system top notch. Again, have you heard anyone recommend 10,000 units of vitamin D for you? Well, according to the new research, this is what they recommend. So I only hope that you compare your current lifestyle, old research and new research, and make a wiser decision in your life to help yourself, your friends, and your family. Because as a provider and as a recent graduate, I often question what I'm taught in school, because healthcare is always changing. Every year they come out with a new publication. Every year they're discussing new findings on what they thought was healthy for us. So in terms of vitamin D and the correlation of COVID patients and these tick bites and the prevention of contracting a disease, I feel like I have to make some adjustments in my life. So as a recent, within the past several years since COVID, I've started to increase my amount of vitamin D to 10,000 units maybe once a week, because at times the providers that I've worked for, they would potentially prescribe 50,000 units of vitamin D on a given day. And then they would say, okay, come back in about a week to 2 weeks, and then we will start you on a consistent regimen. And that consistent regimen only consisted of maybe 5,000 units of vitamin D daily, maybe 2,000 units. But the new research shows that we need 10,000 units of vitamin D. Now, I'll let you make the decision for yourself, but this is just the research that I came across, and I hope this information finds you well, because I want you to be healthy, as well as I want myself, my friends, and my family to be healthy. All right, take care. Bye. Okay, guys, so I just ended my video, but I wanted to show you guys the vitamin D that I take. It's by NatureWise. I trusted this brand because I've researched on Amazon. According to the reviews, I really love it. I typically order products based off of reviews, because in the comment section, a lot of the times people who have taken this vitamin, they report symptoms or their own research findings. So it's pretty much like data-based. I go off the data, the people, and what they think of these types of vitamins. The capsule is about this big. There is 5,000 units per capsule. So according to the new research, I pop in about 2 of these a day. If you look at the back, it says here that the daily value is about 625%. That seems like a lot. According to my research, it's actually very difficult to get vitamin D toxicity. I think a lot of these independent research organizations need to publish new articles for our future medical students to update our books and our systems to help our community in the future. So if you're looking for a good vitamin D, go ahead and check out this brand. I'm not your provider. I'm just doing my own independent research, and I've just been practicing as a nurse. I have some hesitancies about starting my career as a nurse practitioner. All the resources are out there for you. There are tons of smart people out there. Have discussions with them. Just make your own decisions for your own personal life. Okay, well, take care and have a nice day. Bye.